Monday Health Minutes, sponsored by Valley Health.
I'm Melanie Schaefer. This is Valley Health Minutes. It might surprise you that nearly half of Americans have hypertension or high blood pressure, and today we're talking with Dr. John Apgar about that. Tell me about the basics of high blood pressure.
Thank you, Melanie. Yeah, with high blood pressure, also known as hypertension, the force that's within the blood vessels is a little higher than what it normally is. When looking at blood pressure, there are two main numbers that we're looking at. The top number, which is the systolic blood pressure, which is the pressure within the blood vessels when the heart is pumping. And then the bottom number is the diastolic blood pressure, where it's the pressure within the vessels when the heart relaxes. And so those are two of the main numbers that we look at. The target that we're looking for is less than 120 over 80. Once we start getting higher into the 130 over 90, 140 over 90, that's when we are starting to get into the diagnosis of hypertension. Usually in instances with this too, we may not experience any symptoms, but in certain cases we may start having headaches, blurry vision, changes in our vision, chest pain, shortness of breath, dizziness, things like that.
And how often should you get it checked?
Usually, if you're diagnosed with hypertension, you want to try and monitor your blood pressures every day. It is something that's commonly monitored whenever you go to the doctor's office, and so that's where we often do a lot of our screening.
I see. Some people say they have white coat syndrome. You know, they sit down and they have their high blood pressure, their blood pressure taken in the office, and it's always high. Is that really a thing?
That is a very common thing, and so whenever in with doctors visits, if it is elevated initially, usually what we try to do is do a repeat check later on during the appointment. And that being said, some of the more accurate readings are ones that we actually get at home, and so
when you're relaxed a little bit more and not worried about it.
Yeah, whenever you're in your day-to-day routines, that's usually the best times to check it.
With such high numbers of people with high blood pressure, and like you said, sometimes there are no symptoms of it, what are some of the complications that can result from having high blood pressure?
And so if the blood pressures are left untreated, it can cause significant damage to a lot of the blood vessels in our body, as well as organs such as the kidneys, the heart, the eyes, as well as the brain. And so it's one of the main components, one of the main complications with cardiovascular disease, increased risk of having heart attack, stroke.
And no one needs those kind of complications. That can be life-altering for sure. Speaking of altering your life, lifestyle changes can play a very big part in treatment of high blood pressure. What are things that people can do? And if they feel like their doctor says, you know what, those numbers aren't what I want to see.
That's right, and whenever having issues with blood pressure, one of the first things that we want to do is make sure to have those healthy lifestyle habits in place. Wanting to make sure dietary habits, want to try and have lean proteins, fresh fruits and vegetables, being cautious particularly on salt intake. Salt does have a big factor in with our blood pressure. There is a common dietary pattern known as the DASH diet. Doing the DASH diet along with limiting salt intake can play a big factor in helping with blood pressure. And one of the other things along with it is having a routine of physical activity. And so the current recommendations are at least 150 minutes of aerobic activity, such as brisk walk, jogging, cycling, swimming. Those are a lot of the main physical activity components, as well as having some weight strength-based trainings as well.
Yeah, we all need to put that on our to-do list for sure. When your lifestyle changes still don't get the number you're looking for, what kind of medications are out there?
There are a few different classes of medicines that can be used to try and help lower the blood pressures. Whether they're trying to remove fluid from the body, whether they're trying to adjust some of the blood vessels, allowing blood flow to get to certain areas in the body. Those are a lot of the main components. And whenever you're going to be started on one of the medicines, it's always important to take into consideration some other health issues that you may have, some other risk factors, just to have the blood pressure medicine that's right for you.
If you start blood pressure medication, what are some of the side effects you could watch for?
with one of them in particular, the ACE inhibitors, one of the main side effects that people notice is a little bit of a dry, nagging cough, and so sometimes that can be a little problematic, and so then we see about adjusting medicines. One of the medicines, thiazide diuretics, is one where fluid is removed as far as, and so you end up peeing a lot. So some people, if you're taking it at the end of the day, then you're up peeing in the middle of the night. If it's at a certain point and you're peeing a lot, then dehydration also becomes another factor. The calcium channel blockers that are often used, they help open the blood vessels in the body, and so where there's more fluid in those vessels, sometimes it can leak out into the surrounding tissue, and so you can have a little bit of swelling. Some other things to keep an eye out for are if you start experiencing any dizziness or lightheadedness as we go through the treatment, and if we are seeing significant weight loss, other factors like that, there may actually be times where those blood pressure medicines may need to be adjusted so that your blood pressures aren't going too low.
But those medications can help you so much to get that right number, to stay healthy and have you be where your doctor wants you to be. Doctor, thank you so much for being here and explaining all this to us today.
Thank you for having me.
We sure appreciate it. Thanks for being here for Valley Health Minutes. We'll see you next week.